this is a retrospective study that involves a large cohort of IE patients, over 6,000, that we have demonstrated that both pre-admission and in-hospital use of statin, when compared with statin non-users and those who discontinued statin, were associated with a lower risk of 1-year mortality. My name is Kai-Heng Yu, clinical professor of the Cardiology Division, University of Hong Kong. And the name of the article that will appear in Mayo Clinic Proceedings by our group is called Pre-Admission and In-Hospital Statin Use is Associated with Reduced Short-Term Mortality in Infective Endocarditis. As I mentioned, this is a territory-wide cohort between 1996 spanning to 2019, of which we included 6,962 patients with newly diagnosed infective endocarditis admitted to any public hospital in Hong Kong, corresponding to an incidence rate of 4.2 per 100,000 person years. Among the 6,700 eligible patients with infective endocarditis, we demonstrated that pre-admission statin is associated with a 31% reduction of 1-year mortality and 29% reduction of in-hospital mortality compared with non-users. Importantly, our study is the first to show that among those with pre-admission statin use, in-hospital statin use significantly reduces 48% of 1-year mortality and 47% of in-hospital mortality compared with discontinued users. Moreover, we also observed a dose-dependent protective effect of statin against mortality, where higher daily use dosage regimens are more protective. The benefit of statin use was consistent across subgroups, regardless of most comorbidities, causative agents, as well as concurrent drug uses. The current finding shows that the use of statin could be protective for infective endocarditis. As we know, infective endocarditis is associated with poor clinical outcomes, despite the improving diagnostic accuracy, antibiotics, and better surgical treatment. The stable or even increasing incidence of IE is alarming, and therefore new treatment options and preventive strategies becomes quite important. And in fact, there is growing evidence that statin use may improve outcome in patients with sepsis and pneumonia. And our study expands this observation by showing that statin use both before and following infective endocarditis may provide protection in patients with infective endocarditis. So this finding suggests that those who are on statin therapy is associated with less adverse outcome and therefore should remain to be on statin once IE is diagnosed. The additional use of statin to non-users may potentially be beneficial and protective, which again requires validation by future study. So we believe that the next step for expanding our research finding includes a well-planned randomized study, perhaps requiring international efforts because of infective endocarditis not being a very common problem, to pull together a sufficient number of patients for adequate statistical power for research purpose. Thank you for your attention.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.